All right, so Dr. Marjorie Dixon is joining me now to talk about one of those topics, sex, specifically dealing with menopause and sex. And I think this is a topic that a lot of women don't talk about or feel comfortable bringing up to their spouse or, Marjorie, even their doctor.
So you know me, I talk about women's health all the time. I think we need to do more of it, but we really have missed the mark, I think, when we're talking about sexuality as women age. And you're talking about menopause and how menopause affects things, and we've had the hot flushes, difficulty sleeping, mood changes, memory and cognition changes. And the reason that's all happening, menopause literally is meaning when periods cease. And the problem medically is when estrogen and progesterone that are around through the month, those things go away. So when estrogen and progesterone go away, you have all of these symptoms of estrogen withdrawal. So we're aware of that, and we've talked about that. But the one thing we haven't talked about, that talk about taboo topics, is what happens to women's sexuality and sex drive. And when the estrogen goes away, it doesn't only affect all of those symptoms, it affects your vagina. And sex can actually be painful for women. And not just that, lubrication is not the same. And more than a third of women into the menopausal transition will actually report painful sex and long intervals to orgasm, if not anorgasmia, not having orgasms at all. So this is also due to the fact that estrogen goes away.
Okay, so this is sounding like maybe one of the biggest issues that women experience around menopause.
And the fact is the average age of menopause is 51, right? So women are older. You're also more likely to have another chronic medical issue. So maybe you've developed high blood pressure or diabetes, and you're feeling more tired, you're taking care of kids. So your arousal and sex drive takes a real hit around the time of menopause chronologically as well, right? What does libido mean to you? Because I've had women in my office devastated perimenopausally, crying, saying that I have no sex drive and there's arousal is not a thing. And I'm like, I'm about to be your vaginal fairy godmother. I'm going to revolutionize and transform how you think about your sexuality and your arousal, because this is a normal thing and there are things you can do. And the things you can do are pelvic floor physiotherapy. You can actually train, like we train our muscles, you can train your vagina to understand how to get blood flow to the region again, how to improve your orgasms. There are external, non-interventional, you don't have to take needles or anything, that can increase the intensity of your clitoral orgasms perimenopausally. You can also, I know it gets dry, but you can take care of your vagina every day. Think of your vagina every day and moisturize her like you moisturize your face, moisturize your vagina. You can also do other things. There are probes that go to help flow back into the vaginal canal so that it can help you during those times. We always talk about hormone replacement. I'm a gynecologist, but hormone replacement is not the be all and end all. And then finally, there are things that are even sex therapists, because your partners need to understand that you can have a conversation about how this is changing, and even the fact that you might be using a vaginal moisturizer as well as a lubricant. So you can help in your relationship when there's that disconnect. People understand this change and make it better.
Okay, yeah, I think that is crucial, that you should be able to speak with the person that you're most intimate with about what might be going on. These are good conversations to have. But Marjorie, I guess it is really embarrassing, and a lot of women have questions, so we're going to get to some of those now and see if you can help them out as their vaginal fairy godmother. The first question from one of our viewers is, I'm a 45-year-old woman, and apart from my obvious plummeting of hormones, are there other reasons why sex isn't as fun and easy as it used to be?
Yeah, so it's exactly as I said, right? And I get excited about this because I think we talk about everything, but we really haven't talked about us as sexual beings perimenopausally and menopausally. So when I talked about estrogen and progesterone going away, also blood flow to the area isn't as good because the tissue actually shrinks. Your vagina will physically shrink in size when estrogen goes away. And getting an orgasm takes longer. So you have to do things a little bit differently. And so understanding your sexual organs makes you have a better understanding of what you can do to help yourself out and why it's happening. You're not a unicorn at all.
Okay, you just got to switch it up. So question number 2, I've been struggling with asking this question for a long time. Is it normal to not want to have sex at this stage at my life? And this comes from a viewer who is 50 years old.
So, listen, there's no normal when it comes necessarily to sex and how much drive you have towards it or not. It's what's right for you. You know, we can't all be the Samanthas and the Blanche Devereaux, right? Like, some people are not as interested in sex. But around the time of the perimenopause and menopausal transition, communication is key. Things are changing, and you have to use it or lose it. It's not like you watch television and you see these movies, the prescription drug will make it better. We're not like men. Men actually undergo a little bit of a change, and they pop pills and then they get erections. But imagine tab B and slot A not fitting. You have to have the conversations, realizing that 50% of women in their 50s are having sex only. 50%, half of us. By the time we've reached the age of 70, only 27% of us are having sex regularly. So the conversation, understanding how you can improve things, and taking care of your vagina are all key in the perimenopause time.
Okay, here's another one. I've been experiencing some symptoms, and this viewer says it's very embarrassing to talk about, but I've noticed vaginal dryness. We've been talking about this, Marjorie. Is there anything that can help?
So listen, you moisturize your face, you think of her every day because she's the only face you've got. When you think about your vagina, you have to think about her every day and make sure that she's moist. And if you're feeling uncomfortable because of the perimenopause or menopausal transition, where we said the hormones go away and she gets dry, think of her every day and moisturize her every day. So, and this is basic gynecologist in all of our guidelines. There exists the baseline therapy, first line therapy of daily moisture. You get it at the pharmacy over the counter, talk about throwing it into your cart, and you use it every single day. And then in between, when you're going to be intimate and you need in that short term some extra lubrication, that's where you add in a lubricant. And to be clear, there's not just the internal daily moisturizer. Also, women complain about external dryness. So there you have products that you can use externally as well as products that you do internally daily. And then when you're about to have your moment of, you have your moment of intimacy with your partner, that's where you add in the lubricant to give you some extra lube and comfort during that situation. So I think overall, as I said, remember your vagina every day. As I am your fairy godmother, we will not have a vaginal funeral around the time of your perimenopause and menopausal transition. We will resurrect them and make partners and vaginas happy everywhere.
I think that is a good motto for life, Doc. I love that. There should be no shame around this issue. This is the sort of stuff we should embrace. We need all the women's health, sex information. I love it. So this is so great that we can have an open discussion about this, Marjorie, and that not all is lost. And you can still have great sex in your 50s and your 60s and your 70s and beyond. So thank you, Dr. Dixon, for your insight.